our Chief Medical and Chief Safety Officer for PeaceHealth Columbia Network. And then we also have Dr. Jason Hanley. He's our Medical Director at PeaceHealth Southwest. So we will get you all access to video if you'd like that. And then we will get started with Dr. Neville to give a briefing update on where we are at with COVID and sort of the current environment at our hospital. Dr. Neville?
Yes, thanks, Deborah, and good morning, everyone. Wonderful to have time with you this morning. So I wanted to start by just giving a situational update on what we're experiencing in the Columbia Network. So Columbia Network, again, is PeaceHealth Southwest, and then our sister facility in Longview, PeaceHealth St. John. So as of this morning, we have 69 COVID patients at PeaceHealth Southwest. And those are a combination of medical surgical patients, which are sort of routine hospitalization patients, and 18 patients in our ICU. At our hospital in Longview, we have 46 COVID patients, which is really extraordinary when you consider the usual census in total for St. John is about 100 patients. So you can see what percent we've reached. Our capacity at PeaceHealth Southwest in Vancouver is about 92 to 95%, depending on how you count it, which means we are relatively full in general for both COVID and non-COVID patients. But we do have in place pretty robust surge plans to be able to go higher. So a lot of this is driven by the contagiousness of the Delta variant of COVID. As you know, it's twice as contagious as anything we've seen before with COVID. And we are definitely seeing that. 95% of our patients are unvaccinated who come in with COVID, and about 5% were vaccinated and had breakthrough. So really showing just how effective, even though it's not perfect, just how effective vaccination is to prevent hospitalization and particularly serious hospitalization in the ICU. These are numbers that we anticipated based on our modeling. So we do pretty sophisticated modeling of what, working with academic centers like OHSU, what we're expecting to see with COVID. And we are ready. And unfortunately, we don't think we're quite through this fifth wave of COVID yet. We are expecting, based on the modeling, that the numbers will peak in about another 10 days, and that peak will be at about 90 patients, COVID patients, roughly at PeaceHealth Southwest. So again, as I mentioned, we're doing a lot of surge planning. We've got a lot of contingency plans in place. We have really stopped non-essential, non-emergency surgeries in total, just to make room for other kinds of patients who need our help, but also our COVID brothers and sisters in the community. We continue to work with our caregivers on vaccination. We have a very intensive drive in place to get all of our caregivers vaccinated by the end of August of this year. And we have a lot of confidence that we'll be able to achieve that and really be able to provide, therefore, a lot of safety for the folks who work here, but of course, increasing safety for our patients. So that is really awesome. As I conclude, I just want to remind folks that we have really turned the corner on vaccination in a lot of ways with the approval on Monday by the FDA of some of our COVID vaccines, giving full authorization for use and not just emergency use authorization. And that fact, in conjunction with the governors of Oregon and Washington coming out, mandating that those of us who work in healthcare get vaccinated, really gives us added momentum in what we think is the best approach anyway, which is to get vaccinated both in healthcare, certainly, but also outside of healthcare. So we'll be taking questions in a little bit. Right now, I want to turn it over to my esteemed colleague, Dr. Jason Hanley. Dr. Hanley is our medical director for our emergency department, to get a sense of what's happening in the emergency department before patients are admitted to our regular floors into the ICU. Dr. Hanley, over to you, sir.
Thank you, Dr. Neville. Good morning, everyone. Thank you for joining us. I'd like to give you a quick overlook at our department, how we've been doing. I know there's a lot of interest in that in the community. It has been a very challenging few months for us. It's been challenging 18 months, but the last few months have been as difficult as any. There's a lot of interest in our volume and our COVID numbers. So overall, we're seeing about roughly, if you look day to day, around 10%, sometimes a little bit more, 11 or 12, or sometimes 8 or 9%, but roughly say 10% of our volume daily are patients with a diagnosis of COVID. So that is certainly leading to a lot of patients and a lot of sick patients that we're caring for. But overall, our overall volume of patients presenting to the emergency department on a daily basis is what we expect and what we're used to, believe it or not. And that leads to the question of why are folks waiting so long to be seen? Why are emergency departments feeling so crowded? Not only us here at PeaceHealth, but throughout the region, every hospital is near full capacity. ICUs, ward beds, emergency departments, everywhere. That is due to the significant amount of difficulty with moving patients through the system. Patients who are sick with COVID, as Dr. Neville mentioned, it's a good amount of our patients upstairs, tend to stay longer than your average hospital patient. They take a lot of resources and at times are very difficult to place in the community in terms of care facilities because it's just an extra added burden to try to find places that are able to care for these COVID patients. In turn, we are holding admitted patients in the emergency department longer, just as every other emergency department are. And that work is leading to slowing down of our normal 210, 215 patients a day that are presenting to the department. This is leading to a lot of frustration and despair among patients and our staff alike. We do not want our patients to wait to be seen. We're not used to our patients waiting to be seen like this. It's very atypical for patients to wait hours like they are currently to be seen in our department, and it is felt by our staff and patients alike. With that being said, I want to reassure everyone that our amazing nursing staff is triaging patients constantly to make sure that we find the people that are the sickest, we get them into the department and care for them just as we always have. The care provided is excellent, as always. We're putting providers out in the triage area to help our nurses assess people quickly, and we're doing our very best. We also like to thank the community for their understanding and patience. It's been very heartwarming for all the immediate feedback patients are giving us for the support during this difficult time. We often are asked who should come to the emergency department by our community or by physicians or by EMS folks. And we just want to share, as always, if anyone feels they have a medical emergency or they have an emergent issue that needs to be attended to, that is why we're here. That is what we do every day. So please come. With that being said, if you're not sure if you have a medical emergency or you don't think you do, please reach out to your primary care physicians. Consider going to urgent cares to be assessed. If your PCP or your urgent care feels like you need emergency treatment, they are very well versed at getting you to us. I'd also like to announce that we, this week, are rolling out a new process for us where patients that are sick with COVID but not sick enough to require hospitalization and are safe to go home with oxygen. We have a new program where we are getting people oxygen here in the emergency department, sending them home with oxygen services and getting them follow-up that very next day with a primary care physician or with virtual visits here via our nursing staff and experts to check on them. We've done a few patients so far at our trial and look to continue that process as is going well to this point. COVID testing is another question that comes up. We do have a sizable number of patients that come simply for testing. We really encourage patients to not use the emergency department for this. There are resources in the community. We have a flyer here at PeaceHealth that we can give patients on arrival if that's all they're seeking and do not want an emergency assessment. The Washington Health Department as well as Clark County Health Department also have resources on their websites to share with you where to go for COVID testing. And my final update I'd like to give is, as some of you know or have seen, we do have a tent now outside the emergency department. Our goal is to use that tent to expand our waiting room access so we can keep our patients safe by socially distancing folks. And our current waiting room at times gets so crowded. This led to our concern, and we have put that tent up and are close to deploying it to increase our waiting room volume. Thank you.
Now we will open it up to questions. So if any of you have questions for Dr. Hanley or Dr. Neville, if you could use the raise hand function and we can call on you. Looks like Devon Haskins.
Yeah, just a question. A question about your care providers. Can you say how many are vaccinated, percentage-wise or numbers?
Yeah, thank you, Devon. So we started about 2 weeks ago with a higher percentage of our caregivers vaccinated than most health systems. So we felt very good about that. And like I said, we're really focused right now on getting to 100% by the end of this month, so within the next week, and within a week. So most of our effort right now is helping our caregivers achieve that 100% vaccination rate. Thank you.
Kellee Azar, you have a question?
Yes, I have two questions. I had some technical difficulties in the beginning, so forgive me if one of these has already been answered. On the note of staffing, how are you guys doing with staffing? We're hearing a lot of hospitals are short on staff. And then my second question is, when it comes to the emergency department, are you guys having to turn away any ambulances or redirect them?
So I'll let Dr. Hanley take the emergency department question in a minute. In terms of staffing, you're absolutely right. There's, as many of you know, there's a nationwide shortage of key positions at this time. What a lot of folks don't realize is it's not just doctors and nurses, but it's the key caregivers who help us clean the rooms, the patient rooms after a patient leaves. We're also experiencing shortages nationwide again, but also in PeaceHealth and in some of those key but often overlooked areas that help us move patients along and give them a comfortable stay. That said, we have done a tremendous job and really got a lot of gratitude to my colleagues who've worked so hard on this, successfully recruiting nurses during this time of shortage, bringing in temporary nurses, we call them traveling nurses, graduating new nurses, and then really finding innovative ways to stretch the staff that we have so that everyone is getting the proper amount of care that they need. We're also looking very closely at our physician staffing. So for example, right now we've got a lot of our COVID patients in the ICU, and those require really specialized physicians to take care of them. And as we increase the numbers there, which again, the prediction is that unfortunately we will be increasing those numbers, that we will be pulling in additional physicians, including from our clinic areas who have the right training and the experience to be able to help out and extend the work of those key physicians. So a lot of planning, and it is a bit of a stretch, and people are feeling some of that extra energy that comes from having to do that, but really an amazing team in terms of being able to meet those needs. Dr. Hanley, do you want to comment on diverting patients, or at what extent we are needing to do that in current state?
Absolutely. So we're following our standard protocol for ambulance diversion that we've always done. The one caveat is we're on ambulance divert much more than usual. Just to give you an idea, our baseline is about 1% of the hours per month that Southwest is on divert, which is extremely low, probably the lowest in the Portland area outside of the pediatric hospitals. But in the last 6 to 8 weeks, ourselves and Salmon Creek are working together to handle all the ambulance traffic. And we are either both off of divert and the ambulances are going to the hospital of choice by the patient or to the closest, depending on the patient's severity, or we're both on divert, and at that time, it's essentially the same, patient choice or closest to. So we have a very simple system given that we only have 2 hospitals in our region, and we do not necessarily participate in the divert process for the Portland hospitals. So between the 2 of us, Salmon Creek and PeaceHealth, we handle all the ambulances. No ambulances are getting turned away to Portland, and it is working quite well.
Follow up, if you don't mind. You said normally you're at about 1%. Can you give us a percentage of how often you think you'd be doing it now? Because you did say it's much, much more.
Yeah, I'm sorry, I don't have the numbers on it. And it almost, Kelly, it almost doesn't matter because whether we're on divert or not, if we by chance have a lot of beds and we're able to see people we come off divert, we will take all the ambulances for the next hour or so. But recently, if you're not on divert for an hour or 2 and you get all the ambulances, your hospital will be full. And likewise, if Salmon Creek is open and we're closed, it's overwhelming to take all of them. So essentially, whether we're on divert or not, we're sharing all the ambulances, and we have a process in place here that we were talking about a few months ago to do away with divert altogether. There are many examples throughout the country where cities have gone away from divert because it really doesn't work that well for patients, and it doesn't really help emergency departments either. And this is a perfect example of it. Whether we're on divert or not recently, we're both getting a lot of ambulances and we're both meeting the demand of keeping people safe. So most importantly, the 2 hospitals are able to care for all the patients here in Clark County.
That's helpful. Thank you so much.
Sure.
Next up is Amelia Templeton.
Yeah. You had mentioned that you are sending some patients that you evaluate and don't need full hospitalization home with oxygen. And I guess I'm wondering, is that, you said that was a trial, is that kind of an official trial? Is it something that you adopted from other hospitals that have tried it? I'd love to hear a little more about the basis for that and if it seems like it could alleviate some of these challenges.
Sure. Great question. So it's based on systems doing it throughout the country in the last 18 months. We are just getting it going here, given the recent surge and how full our hospital's been. Providence has been doing this since last year. Kaiser's been doing this that I know of, but there's literature throughout the country. When I said trial, we trialed a few patients the last few days just to work on our process and make sure our education to patients is appropriate. But it is going to be live and moving forward from this moment on. We just had a meeting this morning, and respiratory therapy, our nursing staff, our physicians are all going to be educated formally today. And we will move forward and provide patients with a pulse oximeter to monitor their vital signs when they're home. They will get very close follow-up, as I mentioned, and very conservative instructions to return to the emergency department with any worsening.
And the idea is there a sort of threshold with that pulse oximeter? If you drop below a certain level, then you come back to the hospital?
Yes, 92%. If we cannot keep patient saturations above 92%, they're going to reach out to a healthcare provider, and we'll have them return to the emergency department. But on top of that, one of the instructions is going to be if you feel like you're worsening, if your heart rate is going up, if you're having increased work of breathing, no matter the saturations, to return to the emergency department to make sure that you are safe.
Got it. Thank you.
Amelia, if I could add to that. So we're really excited about this because we think it's very safe based on other health systems experience. And as Dr. Hanley mentioned, we're checking in with these patients at least twice a day on, what's your oxygen saturation like? How are you feeling? And it's really a win-win, right? Because then the patient doesn't have to come into the hospital and they get to stay home, which is, usually what they want to do. And then it frees up hospital beds for patients who are sicker. So very excited by this. Really appreciate Dr. Hanley's leadership in that program.
Next question coming from Anthony Macuk.
Macuk, but no worries.
I apologize.
Yeah, just a quick question on the issue of aiming for 100% staff vaccination in the next week. Are there any exceptions to that, like for medical reasons or whatnot? And I guess if so, what is that? What might those look like? And if not, I guess what would the procedure be if you have an employee who claims they need an exception of some sort?
Yeah, so thank you. Great question, Anthony. So we do have exemptions and exceptions that people can apply for, and they really fall into two categories. So one is medical, as you mentioned, the other is religious exceptions. And those are all screened by a rigorous and fair process to see if people meet those. And we're trying to marry that up with really the mandate from the governor and really the governors in Oregon and Washington that they really want to see that anyone providing care is vaccinated. So we are working through, how exactly to keep our patients and the colleagues safe if one does get an exception. Those decisions are made with a lot of, attention to a case by case in the particular scenario that we're talking about, how much patient care someone has, things like that. Again, is something that we want to have those exceptions for when it really makes sense. But the overriding emphasis really is we feel a moral obligation to try to get to 100%, and we will get to very close to 100%. Just because again, the Delta variant in particular is just so contagious that we have got to do everything possible to keep our community safe and our patients safe, and really the folks that work with us safe. Thank you.
Katie Fairbanks, you have a question?
Yeah, just to follow up kind of on that previous question, I've heard a lot of concern from folks here in Longview about, losing staff at the hospital because of the vaccine requirement, just people who don't, want to get the vaccine, and with staff kind of already short, I don't know if there's kind of some concerns about what the situation may be after the end of the month, if you're concerned about losing a certain number of staff, especially here in Longview, and then kind of what conditions it might lead to after that, if there's concerns about, burnout among staff that remain, if they're even more shorthanded.
Thank you, Katie. That's a great question. So we're looking very carefully and monitoring that. Our expectation is that, particularly with the FDA full approval of some of the COVID vaccines, that we're going to see almost everyone go ahead and get vaccinated. The few who end up not getting vaccinated, it's heartbreaking to us. They're part of our family. We feel a lot of angst about that. Again, the overriding clinical imperative for us as healthcare providers is to provide the safest care possible for our patients. And to do that, we really feel like we have to take this stance and try to work through that as best we can. We do and are mindful that there may be the occasional person that elects not to stay with us. It will be hard for them in the state of Oregon and Washington to get another job within healthcare, because most systems are now asking the same thing, and the governors are asking the same thing. So we really hope and are eager to engage in conversation with any of our caregivers who have lingering concerns about getting vaccinated.
And it looks like Anthony Macuk, you have an additional question?
Yeah, just, thanks. One other thing, correct me if I'm wrong, I think one of you mentioned earlier that the model is showing that the current wave it might take another 10 days or so for it to peak. I guess I was just wondering if there's any other insight about what might happen after that. Like, does it sort of plateau at that point, or is there sort of a decline expected after 10 days from now? Is there any other information about sort of what we can expect there?
Yeah, thank you. So we do expect it to peak in roughly 10 days, about September 4th. Then it plateaus for a few days according to the models, and then it starts slowly to come down again. So again, our anticipated peak is about 90 inpatients with COVID at PeaceHealth Southwest. I mentioned that we are, about 70 currently today. So we've got a little bit more to get to that peak. What I'm conveying to my colleagues and folks who are, doing their utmost for the community is we've got a few weeks ahead of us where things are going to be really all hands on deck as we take care of our community. And then it should, the numbers suggest it should start slowing down and reversing, and we should see less patients in the hospital. And in part, that's because of the ongoing vaccinations in our community, and in part, that's because of herd immunity being partially reached and the Delta variant getting a little bit more quiescent in our counties.
Lisa Balick, you have a question?
Yes, thanks. Good morning. Can a patient request care from only staff who are vaccinated?
That's a great question, Lisa. So right now, we ensure that every patient gets the safest possible care. And what that means is, come September 1st, they will all be vaccinated. The few that are not vaccinated or are on their way to being vaccinated, say they've gotten one of the 2 shots, but not the second one yet, we do ask that those caregivers use special precautions. So, for example, they're using an N95 mask and other things to keep the patient safe. So we feel very confident that even as they're on their way to full vaccination, they are providing very safe care to our patients.
Okay, but I guess as a follow, you can't ask to only be seen by people who are fully vaccinated.
We don't, you can't ask, but we also feel like no need to ask because we've, again, sort of taken extra steps to make sure that even those few folks who aren't vaccinated have, essentially zero risk of transmitting that, even if they were, asymptomatically contagious to the patient. And really proud of those efforts that we've put in place to minimize that risk.
Thank you.
So we're nearing the end here. I don't see any more hands. If I have missed someone and you have a final question, go ahead and take yourself off mute. And otherwise, we'll go ahead and wrap this up. Okay. Without hearing any additional questions, I want to say thank you for joining us today. And if you do have any follow-up questions, you are welcome to reach out to the communications department and we can help you get your answers. Thank you all for joining.
Thanks, everybody.
Thank you.